So now today our topic is nerve supply of nose. Both internal and external nose we'll be discussing. Okay. So main four nerves which are in the nose, they are the, I'm writing there, ophthalmic division of trigeminal nerve, ophthalmic division of trigeminal nerve. Okay. Second is maxillary division of trigeminal nerve. This is the first branch and this is the second branch of fifth nerve is maxillary division. Okay, now third is median nerve. This is the autonomic nerve, supply of the nose. And then fourth one is olfactory nerve. I'll be discussing one by one. Okay, I'll be discussing one by one the courses of this nerves. Now first we're going to the ophthalmic division of trigeminal nerve. This is your nose. And now ophthalmic division of trigeminal nerve, first we go for the trigeminal nerve ganglia. Okay, this is your trigeminal nerve. Trigemina means three divisions. Okay, this is your trigeminal nerve ganglia, also known as Gisserian ganglia. Okay, this is your petrous temporal bone. Temporal bone. This is your petrous apex part, and this nerve ganglia lies on the petrous apex of the temporal bone. This is your petrous part. This is your petrous apex, and here the ganglia lies, the trigeminal ganglia, also known as Gisserian ganglia. Okay, and what is the depressed area created by this ganglion is known as Meckel's cave. Now this is your ophthalmic nerve, this is your maxillary, and this is your mandibular. So we are concerning about ophthalmic and maxillary division only. Now first we are going for the ophthalmic division, and so this starts here, goes to the superior orbital foramen. This is your superior orbital foramen. Obviously superior orbital foramen, so it will come in the orbit. Okay, so fine, I'm on the front. Okay, this is your superior orbital foramen here, if you can appreciate it. This is your superior orbital foramen here. Now ophthalmic division of trigeminal nerve comes from this foramen and divides into three main branches. Okay, what are the main branches? The main branches are, one is your frontal. Okay, this one is your frontal division, this one is your frontal division that further gives other divisions. Okay, this one is your lacrimal nerve. Why it is called lacrimal? Because I'm going to show you. This is your lacrimal gland. It supplies the lacrimal gland, that's why it's lacrimal nerve. And the third one, the nasociliary nerve. This is the main nerve we are going to read here in case of nose. This is your nasociliary nerve. Okay, this one straight comes forward. This is your nasociliary nerve, which supplies the nose mainly. Now what happens is, this nasociliary nerve comes here, and this is your ethmoid bone. Okay, this forms the lateral wall of your nose. This one is your nose, this one is your nose. This is lateral boundary of your nose that is formed by the ethmoid bone. Now this nasociliary nerve pierces the ethmoid bone. This is called lamina papyracea. This bony part of this ethmoid bone is called lamina papyracea because it's paper-like bone which lies at the lateral portion of our nose. So what happens is, the nasociliary division, this is your nasociliary nerve, nasociliary division of ophthalmic nerve, okay, goes to nose through this two foramen. Okay, this is your anterior ethmoidal foramen, and this one is your posterior ethmoidal foramen. And the nerve named the same name nerve, this is anterior ethmoidal nerve, and this is your posterior ethmoidal nerve. What happens is, posterior ethmoidal nerve is very short and ends, it supplies some centimeter of your nose and it ends there only. And the anterior ethmoid nerve, anterior ethmoid nerve comes in the nose. Okay, supplies the anterior portion, forms the Kisselbach's plexus there, goes through the Kisselbach's plexus and supplies the internal nose. And then what happens is, it comes in the external portion of your nose through through rhinon. Okay, this is your bony part of your nose, this is your cartilaginous part of your nose, and the bony and cartilaginous part joins together, and this forms your, this is called rhinon. Okay, bony cartilaginous joint, this is called your rhinon, and this is your nasion, if you know. So it comes, the nasociliary nerve, the anterior ethmoidal division of nasociliary nerve goes through the nose, supplies entire interior of the nose, and comes superior portion of your nose through this. This is your external nasal nerve. This is nothing but the continuation of nasociliary nerve, or anterior ethmoidal branch of nasociliary nerve, which is again the branch of ophthalmic nerve, and ophthalmic nerve is a branch of trigeminal nerve. Okay, the first division. So the what happens is the tip of the nose, not the ala one. Okay, tip of the nose is supplied by the ophthalmic nerve. Okay, the ophthalmic nerve, tip of the nose is supplied by ophthalmic nerve, and this portion is supplied by ophthalmic nerve. Okay, this is your all about ophthalmic nerve. And now come to the maxillary nerve, maxillary division of trigeminal nerve, or you can say maxillary nerve roughly. So I'll be discussing about the course of the maxillary nerve. So come here. Again, this is your petrous temporal bone, petrous part of temporal bone. This is your trigeminal nerve, have three gemina, and this is your the trigeminal nerve ganglion or Viscerian ganglion. This is your Meckel's cave. Again, I'm repeating the same thing. And then this is the second division or maxillary nerve of the maxillary division of trigeminal nerve, which passes through this foramen. This is your sphenoid bone. Okay, this foramen is called foramen rotundum. Okay, which present in the sphenoid bone. What happens is it goes through this foramen and goes to the this is pterygopalatine fossa. Okay, this one, if you can appreciate it. Okay, for your better understanding, I'm going to omit this mandible. This is your pterygopalatine fossa. Okay, the nerve, trigeminal nerve, goes through the foramen rotundum and comes here, the pterygopalatine fossa. I'm going to omit this one. Okay, fine. This is your pterygopalatine fossa. This one is your, this fossa here is pterygopalatine. Why pterygopalatine? Because here it is the pterygoid plate of sphenoid bone. Okay, this one is your pterygoid plate of sphenoid bone, if you can appreciate, and this is your palatine bone there. उस साइड में क्या है, palatine bone है, that's why it's called pterygopalatine fossa. That's it. What happens is your maxillary division of the trigeminal nerve comes here. You can see maxillary division, this one. Okay, this one and white one. Maxillary division comes here and it gives off some branches to the pterygopalatine ganglion. This is nothing but your pterygopalatine ganglion. This is parasympathetic ganglion. Okay, this is the largest parasympathetic ganglion. We have 4 parasympathetic ganglion in our system, so head neck system. So this is your largest one. It gives some branches to this one, and what happens is it goes to the nose. Now how it goes to the nose? Okay, some other points I'm telling you here, because the maxillary division gives some other branches. This is not significant here, though I'm telling you that this maxillary nerve gives branches to the sinuses. Here you will have the paranasal sinuses, or it will also give also branches to the palate and all that stuff, surrounding structures. This is not so significant here. Now come to the, which is significant here now. Yeah, it goes to the nose. Now how it goes to the nose? In 2 ways. Okay, there it can, what happens is it can pierce the lateral wall of the nose. Okay, and goes to the nose from the lateral wall. This is not lateral wall of the nose, you can say the ending portion of the lateral wall of the nose, or starting of your nasopharynx. Okay, it goes to the through. Okay, if you can appreciate, this is the foramen here. Fine. Okay, ophthalmic nerve. Okay, it goes to this ganglion. This is what? This is your pterygopalatine ganglion. Okay, goes through this foramen and goes to nose. Okay, enters to the nose. And other division, okay, the other division, this is the other one that comes forward. Okay, forms the infraorbital named infraorbital nerve, and it comes through the infraorbital foramen here This is your infraorbital foramen, also supplies some parts of orbit, you can obviously see here. It comes through this infraorbital foramen and supplies this portion of your cheek and all that. So here we'll know about only the nose, so we'll be concerning. So it's ala of nose, it supplies the ala of nose. Remember, the tip of the nose is supplied by which? This nerve. Okay, this nerve is coming from what? Ophthalmic division of trigeminal nerve. And ala of nose is supplied by what? This is the infraorbital nerve coming from maxillary division. Okay, and other nerve which enters to the through the palatine foramen. Okay, through the palatine foramen from the lateral wall of the nose and supplies the entire of the nose. Okay, this is the two division going through the nose, and that's it about the maxillary nerve. Okay, this is your sensory supply of your nose. And yes, the short nose, the short nerve, very short nerve. This is very easy. This is your olfactory bulb. This is your olfactory nerve, olfactory tract, olfactory nerve, and all that. Okay, olfactory ganglion. This supplies, I think this is very easy. It supplies through this is your cribriform plate of ethmoid bone. This is your, sorry, this one is your ethmoid bone. This one is your cribriform plate, and pierces through the cribriform plate this olfactory nerve and goes to the roof of the nose. Okay, I'm gonna show you. Yeah, you can see like roots, the nerves coming like roots, no, from the roof. Oh, sorry. Yeah, these nerves, this one. They're coming like roots, no, from the roof. They are the olfactory nerves. Okay. Now coming to the parasympathetic supply of the sympathetic and parasympathetic, that is the like autonomic supply of the nose. Now what is the autonomic supply of the nose? Is nothing but the median nerve. Okay, this only one nerve supplies. Now median nerve. Median nerve is formed by combination of two nerve, combining two nerve. What are the two nerve? Greater petrosal nerve and deep petrosal nerve. Okay. Now where is greater petrosal nerve? I'm going to show you the greater petrosal nerve. Now greater petrosal nerve is nothing but the first division of the facial nerve. Where is facial nerve? Here it is the facial nerve. Okay, this goes through the internal acoustic meatus. Here it goes through the internal acoustic meatus and goes to the inner ear and gives off some branches. Okay, the first division of the facial nerve, it goes to the inner ear, and the first branch, this is your first branch. Okay, inner ear gives off branches and it comes from there. This is your first branch of facial nerve. This is your greater petrosal nerve. Okay, this is your greater petrosal nerve, and it combines with the nerve coming from sympathetic plexus, which is sympathetic plexus around the internal carotid artery. Okay, sympathetic plexus around the internal carotid artery. This is the deep petrosal nerve. These two nerves, superficial petrosal nerve and deep petrosal nerve, they together forms the median nerve. And so this is so difficult. This is your deep petrosal nerve, and this is your greater petrosal nerve. What I've said is greater petrosal nerve comes from what? This is nothing but the first division of facial nerve. Okay, and this is your deep petrosal nerve comes from what? That comes from the sympathetic plexus around the internal carotid artery. Okay, I'll be showing you the internal carotid artery later on, but not now. It will be quite difficult to show you here, but okay, fine. So this two nerve combines and forms what? Median nerve. Okay, nerve of pterygoid canal. Also median nerve is also called nerve of pterygoid canal, nothing but because it passes through the pterygoid canal of sphenoid bone. That's it. Yeah. And median nerve now goes to where? It passes through this pterygoid nerve of pterygoid canal passes through this one, like a lower portion of the root of the sphenoid bone, this foramen, and goes to again the sphenopalatine ganglion, or it also called the pterygopalatine ganglion. Okay, sphenopalatine ganglion because it's a sphenoid bone. This one is your palatine bone, this one, or it's also called sphenopalatine or pterygopalatine because this is nothing but the pterygoid plate of sphenoid bone. That's why. Now what happens is median nerve comes here and relays the parasympathetic branch relays here the pterygopalatine ganglion. Okay, this one coming from behind is your nerve of pterygoid canal or median nerve. Okay, and now again it goes to the nose through this foramen. If you can appreciate, through this foramen. This is present in the lateral wall of the nasopharynx. You can say starting of the nasopharynx or ending of the lateral wall of the nose. Okay, or the just approximately 1 centimeter behind the inferior meatus, you can say. It goes pierces this, not piercing, it's going through this foramen and going to the nose and supplies the interior of the nose. This is all about your autonomic supply of the nose. Okay, this is here your parasympathetic supply and sympathetic supply. Sympathetic branch coming from where the median nerve have sympathetic and parasympathetic both supply. So sympathetic supply comes from the plexus around the internal carotid artery, sympathetic plexus around the internal carotid artery, and parasympathetic supply which come from the greater petrosal nerve. Okay, greater petrosal nerve is your parasympathetic supply, and deep petrosal nerve is your giving your sympathetic supply, and these two combines forms the median nerve, and median nerve come from root of the sphenoid bone, there your root of the sphenoid bone, and goes to the pterygopalatine ganglion, relays the parasympathetic one relays on the this is what sphenopalatine ganglion, and goes to the nose through the lateral wall of the nose and supplies the interior of the nose. Yeah, that's it about your nerve supply of the nose. Now